So first off, it's always good to decide where you're at in terms of where you are in your body. You can check with a simple long sit position or a cross-leg position. Notice how comfortable you are sitting on your pelvis. Notice how your pelvis feels, how wide it feels, where you feel like your weight is, how free your tailbone feels. Then you're going to pick the soft, larger ball, and you're going to start with the work. So you're going to lean to one side, place the ball under your sits bone, and then lean back on it. Also lean back on your hands, uncross your legs, support yourself with your arms, and just roll around the area of the sits bone first. The front, the side, both sides, outside and inside. Then you can work your way up the length of your entire pelvic half to your low back and then back down. So you'll just go out in a fan shape all the way to the side. Once you're done with that, take some time to go all the way to the side. So you're sort of turning on your side. You're going to switch to take the ball from the sits bone to the tailbone. So this gets a little bit more uncomfortable, especially if you're not used to it. But you'll just roll back and forth there and go slow. Pay attention to what you're feeling. If you feel a spot that's uncomfortable, don't push into it. Just sort of go away from it a little bit. In a softer spot, take a couple breaths and notice where your body wants to direct the ball to go. Your body will tell you where it feels like you can sort of enter the tissues and enter the fascia. So continue just to work that area between the sits bones and the tailbone. So it'd be like the sacrospinous ligament, the coccygeal ligaments. As you get more comfortable, you can start to sit more upright on the ball. You might not be able to do this first session, and that's okay. But as you get more comfortable, you can put a little bit more pressure on there. But again, I'm paying attention to where the ball wants to go. I'm not forcing it somewhere it doesn't want to go. So you can just kind of sit here and breathe. You can move your leg side to side. Again, you're just going to what your body feels like it wants. So if it feels like your body wants to let your leg fall out to the side, go for it. If you want to scoot the ball forward, go for it. We're just really working on all those tissues in the inferior part of your spine. So your pelvic floor, pelvic fascia. Then you can come a little bit more forward. So now we're sort of lateral to the perineal body. Right up against the ramus of the ischium. So right up against here, inside. So you're just, again, letting the ball direct you where to go. Once you've had enough, you can come on off that side and notice how you feel. Recheck whatever positions you're in. Cross leg, long sit, what do you feel? So I feel a little bit wider, like almost the entire left side of my body is more open now. Less pressure in my knee in a cross-legged position. Then to get the front of the obturator, you want to put the ball right below your gracilis muscle. So follow the line of the gracilis. Right posterior of the gracilis, you have a little space between gracilis and the adductor mangus that lets you in the obturator foramen. So it's going to be tender. You're going really medial. And you're just going to find a spot that feels like, okay, I could hang out here for a second. Keep breathing. You might want to bend your knees so you can rotate over your hips a little bit and see what your body likes. So my body is telling me, I think you can go a little bit deeper and further if you rotate to the right. So I listen to it and I just wait to see what it wants, and then it just takes me back around. But as I'm coming back around, I feel the ball being allowed up a little bit better into my obturator foramen. So I'm right here, so between my pubic bone and my hip joint, right in this obturator foramen spot. So that's a really great area to work. Your obturator externus muscle, the membrane between the two. obturator internus real deep, and then it gets into your deeper pelvic floor muscles. And then finally, if it lets you in, sort of in that space, you're actually accessing the endopelvic fascia, which is the fascia that surrounds all the organs and has a lot of vascular structures in it. So you might even feel, as you get in there, a sense of a little bit more warmness, sponginess. Taking a deep breath. Again, not forcing it anywhere. So it's just rolling back and forth. And I feel like, okay, it's let me in. I don't feel uncomfortable. I feel things relaxing. So then I go ahead and do the other side. And always rechecking. So I've really freed up that left side. And now I would like the right side to feel that way too. So I'll go over all the same structures on that side.